Hi all, greetings. My name is Alwin and I represent TechSci Research. We are a market research based management consulting firm and we conduct research not only across different verticals but across different geographies also. But in our quest to reach out and talk on topics which affect the general populace, we have started a series of podcasts wherein we pick up topics which interest everybody. And one such topic for today is going to be food fortification. I got a very esteemed expert to talk on that. I'm going to ask questions and I'm sure we are going to get wonderful answers. So, without much ado, let me introduce the esteemed guest for today. So, Andres, thank you so much for taking time out and giving us the time to share your thoughts on food fortification. But before we actually start and I start shooting questions at you, uh, it would be great if you can give us short introduction about your own self.
Yeah, thanks. Thanks so much, Alvin, for the opportunity to speak with you and providing the platform. It's my pleasure to be here today, and I think we have a very important topic to discuss. Yeah, my background is that I'm currently working as an advisor for investments, partnerships, and strategy. Innovation always has been close to my heart, which is maybe also why I've been the director of the Bill and Melinda Gates Foundation in nutrition for a good deal of 3 years, where my main focus was on creating market-based innovative programs that are investable, that reached a triple-digit $1 million of co-investment, which 60 million came from private sector, which was a little bit the ask to me, bring more innovation in private sector to the table in nutrition. And as we all know, right to food and right to health depends also on products. People need to eat something, and that's predominantly the private sector providing these foods. Before that, I have worked with multiple sectors, including private sector, on inclusive nutrition strategies, providing access to nutrition and health for all. Some of my results have been major, large-scale, multi-sectoral partnerships, some of them reaching millions, hundreds of millions of people. So none of that had been possible without great partners, great staff, friends, and other professionals in that community. So that's a little bit on my background. I'm currently based out of Germany, and yeah, looking forward to our conversation.
Great, great. Thanks for the intro. So my first question would be so let the general public understand what actually is food fortification.
That's a great question to start with. And before coming to food fortification, I mean, I would be glad if the general population, including myself, would completely understand nutrition, which for many is such a black box. We all believe it's very important, and we understand that health and well-being depends on good nutrition, but it's I would say largely invisible. It often doesn't taste. The market doesn't recognize it properly. So there's many shortcomings, which is the reason maybe that we have largely half of the population suffering from one form of malnutrition. Fortification is one intervention in nutrition to correct these things. Among dietary diversification, you just eat a better diet, you can remodel the food system, you can look into innovation, you can take supplements. None of that is food fortification. Food fortification means adding essential nutrients to staple foods the broader public, including those of a lower socioeconomic status, consume. Examples are rice, maize, wheat flour, sugar, oil, and salt, not to forget rice, very important in India. And in different forms, you add essential micronutrients across the board that help populations to prevent disease, morbidity, and mortality from malnutrition. So it's a measure of public health, preventative, very cost effective. It's executed by the millers, but it largely benefits from a policy environment. So it's also a multi-sector initiative.
Okay, so tell me when did this actually start happening? What made people look into fortification at all?
Yeah, I mean, the first forms of fortification were reported from the 1920s. It's often Denmark being cited as one of the early countries putting some essential micronutrients in affordable staple foods. In Europe, it has been also margarine. Very prominently, we know iodized salt, which is nearly a universal thing. And it started in the 1920s, 30s, and became very popular after World War II, where large masses of population didn't have access to nutritious food. And we all know, I mean, nutritious food can be more expensive, and it is more expensive. Many of the nutrient-rich foods are maybe not that rich in calories, so they lack the calorie density to fill your stomach. Take carrots, for example. Carrots per calorie are much more expensive than rice, for example, but carry some micronutrients you need for your eyesight. So more and more, I think countries, governments, public health institutes realized it's very difficult and costly with targeted interventions alone to reach people. Why not going more preventative? And you still have fortification in the US with iron, with vitamin A and D in milk, and folic acid for pregnant women. So worldwide, roughly, I think salt iodization is beyond 170 countries. Flour fortification should be around 80. Edible oil fortification around 40. Rice fortification has the fastest growing number of countries, and some of the countries mandate these programs because they want all the producers to participate, because it doesn't make a lot of sense if it becomes the top of the shelf healthy, functional food item for the rich, which typically are not those who are malnourished. And then the cheaper producers free ride. So that's the reason why many countries mandated that by policy and call on their producers, including imports, to comply with these regulations. The nutrients levels are fairly low, so it doesn't substitute a healthy diet, but it prevents the worst, if I may say so. So even kids or pregnant women and adults benefit from these additions of nutrients.
Okay. Any success stories that you can share of any country or anything that has become a success?
Well, I think many programs around the world could be cited as a success, and there's a lot of evidence that if you regularly eat food that is rich in micronutrients, including fortified food, that the nutritional indicators in your body move upwards, and there's additional evidence that if your nutrition indicators are in the normal range, you can prevent a lot of disease. And so I think the main factor of what I would consider is a success is, are millers willing and able to put the quality nutrients according to the label claim in the food? And is the government able to provide a quality assurance that is really making sure that what is labeled is also in there? I mean, the cost addition is very small. It's typically 0.1 or 2% for edible oil, which easily mixes with the oily vitamins, up to 3-4% for a bit more technically ambitious fortification, which rice is part of it. However, I think many of these programs deliver constantly as we speak. It's a constant, I would say, awareness needed of all the stakeholders. Why are they doing it? So it's easier for me to cite programs that came in trouble. For example, in one country, a new minister of health came in office and said, well, we don't have any goiter anymore, which is a reason because why you iodize the salt. And he said, can we some of my employee friends told me, can we skip that iodization? I mean, it costs him a couple of pennies. And he said, well, the problem is faded. Why are we doing that? And then somebody smart educated him and said, well, the problem is no longer there because you have compliant salt iodization. And we see countries that sometimes feel they listen too much to voices saying, well, every cost addition is bad. We should kind of scrap that. I think countries are successful if all the stakeholders understand the benefits from the program. And for government, it's that you can, in the most cost-effective way, pretty much, I would say, with minimal investment from public budgets, keep a market-based nutrition intervention going, reduce nutritional deficiencies, which is a task originally of the government. However, for millers, it's a value added for their products, and I think they are becoming part of a public health solution and nutrition solution, which is valuable to them. I think it takes a certain spirit in the entrepreneurial side to understand how and why am I creating value to society, and how can I make, I would say, something positive about that. And I've talked to millers in 60 countries I worked in on fortification, and I've sat in front of millionaires and billionaires that own half of the food sector. And reasons why they engage are very different. Some are saying, well, you know, I got rich and I have a good living. I have enough to eat. I produce food. I want to produce not only calories, I want to give something back to society for the kids and the women and the broader public. Some say, well, you know, I'm producing rice, others producing rice. So what is the point? Where is my unique proposition? I want to be the champion that introduces that program by innovating and by taking a technical challenge. And I believe a value added to my product is great for my employees, is great for my company, is great for my political relations, because I'm part of a solution there. And others are just waiting for a mandate to kick in and say, well, I'm compliant with the law. I need that good consciousness, and there's no double standards. I will do that 100%, and I will even speak to others to do that, because a level playing field makes it even for everyone, and then cost is neutralized. Everybody bears the cost, so we can do good without any comparative and competitive disadvantage. So that's, I think, the ingredients of success that. The multi-sector alliance that keeps that program alive, including academics, including non-profits, to make it effective. And I think the most effective programs also look at pockets, deeper pockets of deficiency, where you need more targeted approaches. I mean, people living on food banks, people living on food stamps, and I think India has a very sophisticated system of providing food assistance. They need a higher level of fortification and nutritional addition. So how can you make sure that targeted products, which are more dense in micronutrients, more dense in calories and proteins, how can we make sure that those reach those in most need, which fortification maybe is a little bit one size fits all and doesn't do justice to the deeper cases of malnutrition.
Okay, so any challenges that you see in the industry which is going on?
Well, you know, it's as I said before, it's in many countries a process to start with, and it's never too late to get started on fortification as a company or even as a country. So typically, it has been published also by me on kind of a clock model where you have 4 segments. The first segment is kind of forming a multi-sector consensus on nutritional deficiencies, which is, I think, one of the important starting points in these days where, you know, science is at the crossroads and people often deny even scientific figures. I mean, it's not so easy, and it takes, I would say, brave leadership of a country to admit we are not yet fully able to feed all of our people, and these are the numbers, these are the geographies. And I think one of the biggest challenges here is data. Data is fairly costly. So long story short, we have a lot of white spots on this map, and I have big hope that in specifically India and the future generation of leaders will be able to apply machine learning and AI to give us a much better picture where malnutrition sits. I think it's interesting that we have official data, and important, that says in India, well, there's 35% of child stunting still, and there's 60% of women being anemic. Then coming to the second challenge is, are we exactly knowing where high quality fortified foods are eaten and what contribution they do to nutrition? That's important for politicians and also for business people, because they want to understand if they invest, how much good do I do? And the amount of disease-adjusted life years, which is our currency in public health, like how many years, healthy years can I gain, is a big incentive to do that. But currently, many of these mills, including rice millers in India, not necessarily have transparency neither over their supply chain nor about the value chain and the impact. So I think it would be an enormous step forward, and there's pilots also currently underway, also based on the strategy I was part of at the Gates Foundation, currently investments going in, more IT-supported transparency in tracing the nutrients through the chain, making sure we understand if we give out rice to beneficiaries and with a fingerprint we even have their identity, why can't we then not better track the impact, make the impact maybe even investable, and align other efforts of the complementary nutrition interventions around this data of deficiencies and impact. And I think this is the major opportunity, I would call it, in the future to apply digitization and innovation in IT to make nutrition interventions like food fortification more effective, to ensure the quality of the programs, and help where data just is unaffordable at scale.
Any kind of misconceptions among consumers or in the industry, or any kind of resistance that is happening?
I think the biggest problem in nutrition as such, not limited to food fortification, is that it's full of market failures. So, and I know it from myself, from my kids, like whatever is tasty is not necessarily healthy. Whatever is healthy, I not necessarily have the right level of information about it. So I think one of the problems to start with is that millers, in particular those who are voluntarily starting these programs, are not necessarily receiving more consumer appreciation. I mean, the second is often you find rumors that could be from people that say everything has to be just in the natural order. There's other people that kind of from a religious point argue about that at the end of the day it's scientifically based. It's obviously there's a limit of a budget you can attribute to educate each and everyone about the safety of these food. They also have been tested. They are approved by the regulatory authorities. There's long studies been undertaken, but most of the time with the multi-sector effort that the producers put meaningful information on the food, maybe do an extra mile when they introduce it. There's a Food and Drug Authority, there's a Ministry of Health, there's a Nutrition Institute. All of them give their very best to educate, in particular, people with a low socioeconomic status and education, that altering food to be more nutritious and healthy can be a matter of life and death, or opportunity or no opportunity in life for their kids. And that's a constant challenge to be taken on, where I think also academia has an important role to play.
Okay, so any recent innovations in the industry which has been exciting you?
Well, you know, I'm currently working on a broader scope of nutrition, and I think there's a lot of very interesting innovation fields happening. One is, for example, circular food concept. I'm a great fan of also biodiversity smart food and the blend of naturally nutritious food with fortification wherever needed. So, for example, look at the food systems pathway. All the countries have signed on. India also utilizing local crops, including rural supply chains from farmers, using underutilized crops, and those who are drought resistant. So there's sources of food that can be nutritious and part of a nutritious food system beside of fortification. And I think none of the community would say fortified food is the end game scenario of a healthy food system. At the end of the day, I think we all want to reduce the levels of staple food fortification and improve the offerings on the regular plates to be more nutritious and more healthy. So there's a lot of innovation in and around the sector. I think the largest innovation in food fortification is probably the possibility of digitization and tracing the ingredients. I mean, in the pharma industry, active ingredients are traced so that they are in the generic products, and consumers can, with a QR code on the package, understand where is there the Pfizer ingredient that is labeled on that generic product from Bangladesh. Is it in there, or is it just an empty tablet I'm swallowing? And I think this is important for everyone, for the producers that put an effort in, they have skills they need, they have to put machines in, they buy the nutrients. For the suppliers of the fortification premixes, it's important that they compete on a level playing field, and I work with a number of them which are on the quality side, and they also want to make sure that they are not undercut by price by subprime materials. So that tracing along the chain with sensors in the factory that make sure with a QR code there's an official batch of an ingredient coming from a nutrition supplier, and in the food, when I'm a consumer, I can, with a QR code, lot by lot, understand is that a real food or is it a fake food, is probably one of the areas of innovation. I think also we need innovation in more localization. So when we look at food emergencies, if we look at emergency foods, it so far has been a globally standardized product from peanuts with a certain set of micronutrients. I think there's multiple channels in every country, from the healthcare system, from the school system, from the food bank and assistance system, where quality, local formulation and innovation in these products is needed. And I trust, even so, India is a large producer of peanuts. It could be Indian peanuts, and it could be other forms of Indian ingredients that also make these products meeting the culture and the taste of the country where it's used in. And at the same time, it complies with international standards in terms of what the science says humans need if they are in a difficult situation. And we all, in nearly all countries, have societal groups which cannot afford a balanced diet. Some of the people could afford, and they just don't know how and don't pay attention. So I think we need targeted products which, in a market-based fashion or in a public distribution fashion, are coming from local sources and are kind of driven by local producers. That, for me, this localization of nutrition, maybe also in light of the news we see this week that international assistance is not getting stronger with major players exiting. I think we need to rethink the way how private sector, how the local, I would say, stakeholders can take the fate of nutrition a little bit more in their own hands. And local production, for me, is then at quality one of the, I would say, major needs for innovation.
Okay. Thank you, viewers. We'll soon come up with another interesting topic. Till then, stay tuned with TechSci Research.